In Nairobi, a groundbreaking training program on health journalism and public health communication has brought together participants from across Africa.
Have access to these clean, modern fuels.
Hosted by KEMRI Graduate School in partnership with Clean Air Africa and the University of Liverpool, the goal was to bridge the gap between science and storytelling.
So it is a great pleasure that I stand before you today at the closing ceremony of this transformative training on health journalism and public health communication. On behalf of KEMRI, I would like to express my heartfelt gratitude to all of you who have been part of this enriching journey. This training, which was brought together 14 participants from 4 countries, that is Uganda 2, Tanzania 2, Cameroon 3, and Kenya 7, has indeed been a remarkable opportunity to enhance the essential skills of journalists, public relations officers, and health managers from diverse institutions.
The involvement of Willow Health Media into this initiative has allowed for enhanced learning, storytelling, and visibility of public health messaging across the continent.
Let me first appreciate the great partnership from Willow. Dr. Masi, asante sana.
Thank
you. This could not happen. You are not because of you. So the information that we get out there, which is actually coming from our work, can either build us or destroy us. And our greatest partners we need is the journalists. But for the journalists to work with us, which we have really been having a very good working relationship with the media in KEMRI, we say we need to strengthen that by actually doing the empowerment in terms of the information that they give out. Not only within us here in KEMRI, not only in the whole medical field, but also across in other institutions, in the universities, who are doing researchers like us, need to really have this particular association or this particular capacity built on the journalists, so they can be able to be really portraying the particular type of information that rightly comes from our work. Because not only the reporting is not only very key in terms of creating the impact that we require, but also in terms of the funding that we get. Because when we disseminate our information correctly to the public, to agencies, to other associations, and they get it, immediately we manage to get our funding to continue that particular work.
With the growing need for accurate and responsible journalism, Dr. Mercy Korir reaffirmed the need for empowerment and capacity building within media institutions.
I'm glad that this partnership has yielded something that, everyone is proud of. Sometimes until other people say it, you may not see what your impact is or what the value is, but seeing everyone appreciate that, as Willow Health Media, we are really, really grateful. Congratulations to each one of you for the outstanding achievement. Today we celebrate not just the completion of your training, but the beginning of a journey that holds the power to change lives and shape the future of health communication in Africa and beyond. I say Africa because we are in Kenya, yes, but we've had graduates from Cameroon, from Tanzania, Uganda, and we'll have from Rwanda in the second cohort, and hopefully to the other African countries. Health journalism in Africa is largely unexplored, with only a few dedicated journalists and platforms giving it the attention it deserves. When I moved into health journalism some 8 years ago, the question I used to get, and I still get that question, is why are you leaving medicine? People see medicine as a noble profession. When you go to medical school, you're the creme de la creme, and people think, why would you go to journalism? But I think through this course, you've seen what the power of communication is, what the power of a well-told story is. And that's what we strive to do on a daily basis. Since our launch, we have dedicated ourselves to nurturing a new generation of health journalists just like yourselves, and that's why we were more than happy to be part of this program. We recognize that health journalism is not just about reporting statistics or medical breakthroughs. It is about translating complex health information into narratives that resonate with people, which inspire behavioral change and hold institutions, including governments, accountable. If you come to our organization, we say we are video first because looking at the data of digital consumption, video ranks high. That's why you see WhatsApp is high. TikTok is actually overtaking even Facebook. Facebook is there on the list. Then I think the third one should be Twitter. Then you come to Instagram. It's leading because it's video fast. But of late, we've seen you can just generate a digital video using AI. So that's where we come in as professionals, because we are able to come to Dr. Mitari or Professor Songok and actually do a credible video of the actual information so that we can populate the information, or we can give the audiences credible information that is not AI generated. AI is good, but there are people who will take advantage of that to do their own misinformation.
The collaborative training program has brought together experts, researchers, and media professionals from across Africa to strengthen the intersection between science and communication. Key stakeholders shared insights on the importance of accurate and ethical communication in public health.
This has been led by, as you've heard, Clean Air Africa, that Dan has mentioned, the KEMRI Institute, and particularly the Graduate School, in partnership with Liverpool University and funding from NIHR. And I also want to just highlight the emerging collaboration with Willow Health Media, which has been extremely important, and we really hope to be able to develop that further. We're up against a world of the internet and social media with incredibly fast communication, often communication of misinformation and fake news. We're up against, well, it's always been the case in storytelling and journalism of if it bleeds, it leads, of sensationalism, but I think that's just getting more and more to the fore.
Over the past 8 weeks, participants have really gained insights, as you have seen, in identifying impactful health stories and translating complex scientific research into accessible narratives and ensuring ethical and responsible reporting. We have seen onboarding of Willow Health Media and the great support that they have offered, because we even had the opportunity to visit Willow Media right here in Upper Hill and to showcase the infrastructure that they have. And Daktari is a great institute, and I really appreciate what you have put in place. And most importantly, the impact that that gives with regards to the viewership or visibility of these kind of health outputs.
As the ceremony drew to a close, Willow Health Media reaffirmed its commitment to nurturing credible health reporting and supporting cross-sectoral partnerships that drive evidence-based public health conversations across Africa.
On behalf of Willow Health Media, my other colleagues in the media industry, I congratulate you once again. The future of health journalism is now in your hands, and I have no doubt that you will rise to the challenge. Thank you, and congratulations, Cohort 1 of 2025.
For Willow Health, my name is Yvonne Kawira.